got me? All right. Can everybody hear me okay? Awesome. Well, thanks for coming. This is a nice big group, about 100 it looks like, 101. I'm Tony Boaz. I'm the director of AR Connect. It's a UAMS virtual mental health program. I'm also the director of Strive, which is the school-based mental health program. And we offer services in North Little Rock and Little Rock school districts, as well as a couple of charter schools. So what we're going to do today is just kind of go over some mental health in a virtual world, but cover some general information about mental health awareness, some things about AR Connect, how mental health and technology come together. A lot of it's good, sometimes it can be bad. Anytime you guys have something, questions, things like that, raise your hand and we'll get a mic to you. We can do it at any point. That's our grant. We're funded by a COVID response grant that was given to us 2 years ago, and this is the AR Connect program. I'll talk more about what it is, but we break a lot of barriers that are traditionally there for folks needing mental health therapy and psychiatric help. So today's objectives, we'll define what mental health is. We'll look at the importance of mental health awareness. We'll talk about our program, and then talk about generally mental health in a virtual world. So, first question of the day. Do we got any brave people in here? Lots of brave people, obviously. There's one way back there. What's mental health? Okay. Close, but I mean, you're right there. It's our emotional, psychological, and social well-being. How we think, feel, and act, all of it together, right? So when you hear things like anxiety, depression, anger, things like that, that's all states of our mental health, right? And they're not necessarily bad. It's just what we do when we're feeling that way. So just keep that in mind. What factors affect our mental health? Anybody have any ideas? Yes, ma'am.
Your surroundings.
Okay, awesome. I'm sorry? Isolation, certainly. What about our family? Do our genes have anything to do with our mental health? Yes. So there's biological, so genes, brain chemistry. Environment, where you live, access to resources, education. Life experiences, all of us have different experiences here. And all of us process those experiences differently. What happens to one person or happens to two different people, they can process it two different ways, right? And it affects them differently. So if you've had different abuse, been exposed to trauma, had some historical events, car wrecks, things like that, those can all be negative, have a negative impact on you. And then lifestyle. A lot of you may or may not know this, but your diet plays a big role in how you feel. Exercise, obviously, and then sleep. Sleep is one of the most important things that we can do for our mental health. Who gets more than 8 hours of sleep a night? Who's told to get more than 8 hours of sleep a night? There's a reason for that, other than giving your parents a break. I'm kidding. I have a 13-year-old, so I can make jokes. But that's when your brain resets itself. That's when your body is resting. That's when, that's the best part of the day for you, really, is you just quiet. You're getting ready for the next day. Now, I don't get 8 hours of sleep. I would love to get 8 hours of sleep, but that's the goal. I messed up. What is mental health awareness, right? So it's the perception of how we're doing. It's our own thought on how we're feeling, keeping up with how we're doing that day. Understanding our decisions and the thoughts play a big part in it. But why is it important to be aware of our feelings, at least our mental health? Does anybody have an idea? Yes? Say? Yes, it could be impacting others as well as yourself, obviously, right? So, why is it important? If you know you're feeling certain ways, then it's going to increase the likelihood of you getting help, right? If you know what the symptoms are of feeling depressed or anxious, anger, whatever it may be, then that gives you the opportunity to reach out for help. It also increases the chances of early intervention. The earlier that we intervene with any sort of medical issue, and mental health is a medical issue, the quicker we can resolve it, right? It's a lot easier to handle a child that might have some anxiety symptoms at 6 years old rather than when they're 26. That means they've been dealing with anxiety for 20 years. If we can find it when they're 6, it's a lot easier for us to treat it and them to move along and not have it. And obviously, if you know that you're having some issues and you get help, then it decreases the likelihood of poor decision making. Sorry, my phone. I just got a phone call that was buzzing. I was wondering what that was. Here's some data it's about 2 years old, but if anything, it's an underestimate. So depression and anxiety are the two biggest diagnoses that we will see in teens. Depression, everybody know what depression is? Right? It's like a sadness, but it's something that happens over a long period of time. It's not just you're sad because you had a bad day. It's a sad over, I think it's 6 months at least, right? So that's one. Does everybody know what anxiety is? Right? We hear it all the time, but does anybody get nervous before they do a presentation? You know how you feel those butterflies or jittery or just like, it's like that all the time. When you get done with your presentation, you don't feel that anymore. You usually feel relieved. But if you're suffering from anxiety, you don't have any relief. It's just that ongoing feeling like that. Okay? So those are the two main that are diagnosed with kiddos. According to this, 9.2% of youth cope with some sort of major depression. That means they are diagnosed with it. This is pre-COVID data too, by the way. This is from a presentation I did for a special education group out of Conway. So I would say that number is a lot higher now. So, I mean, it's probably getting better now since we're trying to get back to normal, going to school, interacting with folks. But that time period when you were at home, not being around to being around friends, things like that, isolation, as someone mentioned earlier, it had a big effect on folks. Even this data from, I said 2 years ago, I think it's 3 years old. It may actually have a date on it. It'd probably be good for me to look at, but it doesn't. 59% of folks with major depression do not receive any treatment. So almost 60%. So 6 out of 10 people. So if there's 100 people in here with depression, 60 of them aren't getting any kind of help. Right? That's not good. Because people experiencing this at a young age most likely are going to continue experiencing into their older age. There's lots of reasons why people don't get help either, and we'll cover some of those in a minute. And then it says overall 55% of high school students don't know where to go to get help for their mental health. How many high school students we got in here? Just raise your hands. Lots of you guys. Do you guys know where to go if you need assistance? Yes? Most of you? I mean, there's a lot of you might have providers at your school. A lot of you can go to your guidance counselors. A lot of you should go to your parents too, but that's not necessarily where we want to go. But those are some obvious good choices. Uh-oh. Oh, I'm sorry, let me do this. So here are some barriers to getting mental health care. And this is really, and this is Arkansas, because that's where we're at, obviously. But these barriers extend beyond just our state. So one of the barriers is cost. Mental health care is expensive. As any care is expensive. And then people that don't have insurance typically don't go treated. And that's not necessarily fair to them. They don't get to choose if they have mental health issues. So that's an issue. PCP referral requirement. Who has a PCP? Primary care physician. You have to go annually to see him, or you're supposed to. It's kind of like that 8 hours of sleep thing, right? Anyway, so my other group Strive, the school-based group, we have to have, if the kid has Medicaid insurance, we have to have a primary care physician referral in place in order for us to see them. So if you present to us and you've got depression and you're not feeling good at all and you're in a crisis, I have to wait. I mean, I can treat a crisis, obviously, but if it's something that's an ongoing thing, we have to wait until all the paperwork and everything's in place. And that's a barrier. And then stigma. I don't know why. You guys might be able to tell me. I'm kind of old, been around a while, but there's some sort of stigma with having depression or anxiety. I don't know, people think it's, yes ma'am.
A lot of people are scared to come to terms with themselves. It doesn't matter if you know you have it or not, it's not always going to be accepted, and especially in the day and time where we live. It's a common thing to have, yet nobody wants to acknowledge that it's a common thing to have. We can tell everybody that they have issues with themselves, but most people won't come to terms. It's a really big issue.
Well, that's the stigma, right? If people treat you different because you have anxiety or depression, then you're not going to want to come forward. Yes?
It seems like if you have depression, you just stop being sad, or if you have anxiety, you just stop being nervous. And like when something's seen as too common or like not common enough, it's seen as like it's just not worth being talked about.
And then also mental health, when it comes to mental health, since it's not like a physical disability they can physically see, there are people out there who just like either do it for a quote unquote trend or like a quota, and then people telling you that you're making it up. And so therefore, people who are suffering with mental illness don't want to come out with it because it's either that you're pretending, or since it's not physically seen, there's no reason you should have it. And so because of that stigma that exists, people don't come out with it.
It's all excellent. We got one more up here, and then
we didn't have that whenever we were younger. We didn't do that whenever we were younger.
Yeah.
So it's kind of just they brush it off and they're like, oh no, you're fine.
yeah, just rub some dirt on it. You'll be all right. Right? You ever heard that saying? You wouldn't want to rub it on your head, though. But the idea of what all y'all said is right on par with stigma, right? It's even, you see the facility, like there'd be an outpatient psychiatric facility, Centers for Youth and Family, for example. People have to actually physically drive there, get out, go there. And some people won't do that because they're afraid that someone else might see them going in there. So, we've been trying to decrease the stigma for a long time, working in this. I've been a therapist for, I've been in behavioral health since 95, a therapist since 99. And the stigma is the same, right? Actually, there's more prevalence of mental health issues than there were 22 years ago, or 23 years ago, rather. So we're trying to do some things with that, and we'll talk a little bit more about the stigma. But to your point where it can't be seen, right? That's a good one. I mean, if you break your arm, you're going to get it fixed, right? But if you break your arm, you're going to go get it fixed. You don't sit around waiting for it to hopefully get better. So that's kind of the thing with depression or anxiety, and saying just to quit doesn't work that way, right? Unfortunately. I wish it worked that easy. Another barrier is long waits for appointments. With this AR Connect program that we're running, we're open to the whole state. And so we do short-term therapy, and when somebody needs longer-term therapy, we're referring them to community-based providers. And what we're finding is that there are 6-month wait lists for some people. And I mean, fortunately, there's lots of therapists in the state, and so we can, usually find something that's not that long of a wait, but that is a huge barrier. And typically, rural parts of the state are going to wait a little bit longer. Unfortunately, there's just not as many providers. Do you have a question? She's coming. We're going to make you run all over the place with that microphone.
Is it better to get a therapist instead of talking to a family member or somebody close to you?
Well, better. They're just trained professionals. It's not to say that your family member, you should go to your family members as well. But therapists are licensed. They're trained to do that job. They get all kinds of specialized training. It's not to say that family member, there's not a value to that. I would never say don't talk to your family, but there's obviously things your family members might not be able to handle, and so that's when you go to a trained professional.
Hi. My thing with the long waits for appointment is that sometimes people don't have enough time, you know. After waiting for so long, you kind of feel defeated, or some people just can't wait that long. It overtakes them because it's getting so bad, and I feel like that is a huge problem now.
Oh, it is, definitely. I think what we've seen with COVID, you know, just with the increased isolation and things like that, it's just created a lot more need. She's coming. We got one more here. Y'all gonna ask me all kinds of questions, which is great.
Okay, yeah. So this is just like a general question to you specifically. So earlier when you were talking about how mental health, like treating mental health, is quite expensive, even though like it's something that's normal and happens just like to anyone. What are your thoughts on the system of how we treat chronic illnesses and how expensive chronic medication is?
Could you repeat? I'm having difficulty hearing you.
What are your thoughts on like chronic illnesses and how expensive it is to treat a chronic illness?
Oh, well, it's obviously a big problem. We'll stay in mental health. Mental health, we have chronic mental health issues. Depression can take that on. Have you heard of schizophrenia, bipolar? These types of things are lifelong things that you would have. Yes. Oh, we've got somebody in the back. Okay.
We have a question from one of our virtual participants asking, what are the best ways to fall asleep quicker so that my mental health will be better?
We are going to cover that in a later slide. But to follow up with you, we would hope that there would be some advancements in certain medications and practices that would make things cheaper. That's what all the research is for. Part of UAMS PRIs, we've got a huge research component, and this particular grant, this AR Connect piece, we're doing a research piece to this. There's a lot of data analysis and things that we're doing with that. We're finding that as we treat people virtually over 4 to 6 sessions, we're seeing their depression rates go down significantly. Same thing with anxiety, and that's just studying it virtually. So, you know, continued research will have an impact on cost of everything. All right. Oh, lack of awareness of resources. That's the last little barrier. And all that really means is you may not know that there are certain things out there, right? Like if you say you're having trouble getting insurance. Well, there are certain places you can call that can help you get insurance. Same thing with education-related resources, job-related resources, things like that. One of the pieces that we do at AR Connect is we have 4 different care coordinators that get assigned to each patient, and if a patient has certain needs, they go and find it for the patient. We also have a resource center online that if you're looking for certain resources, it's divided up into 5 areas of the state, and you can look there as well. So, and I have a flyer in the back, so if you guys are interested in any of this stuff when you leave, grab one. Okay, I keep hitting the wrong button. All right, so barriers to mental health. And this is where we start talking a little bit about AR Connect. AR Connect, like I said, is the virtual mental health and substance abuse program for UAMS. We started almost 2 years ago. We're totally grant funded through SAMHSA, and we're funded, guaranteed funding through May of next year. So six things to know about us is, I'm sorry, I didn't build this. Yes, okay. So it's the mental health and substance abuse clinic. What anybody in the state can do is, we have a phone number, and it's at the bottom of each slide. If you're experiencing a mental health issue and you don't have any resources, you don't have a therapist, you can call that phone number. It's not a crisis line, but the very first person that you reach will triage. It's going to be a nurse that triages your case to make sure that it's not an emergency. If it's an emergency, they're going to refer you, and I'm talking about you and your parents, obviously, to an emergency room. If it's not an emergency, then they will schedule with us and we will do an intake call. After the intake call, you get assigned a therapist, and then we begin virtual sessions. And I said earlier, it's a short-term program. We can see an individual up to 6 sessions, and that's usually once a week. And so while we're seeing them, if there's a medication need, maybe an antidepressant, anti-anxiety, something like that, we have psychiatrists available to us that can also assist with that. If for some reason we can't resolve your issue of depression, anxiety, whatever it may be in that episode, those 6 sessions, we will find care out in the community for you. And we'll make sure it's not someone you've been with before if you don't want to be with them. We know that's not a good fit. So that's an overview of that. We're accessible 24/7. Does that mean a therapist is available 24/7? No. But you can call that number and you will reach somebody, and then they will set you up with the next appointment. And it's either one of those numbers there. 526, that's just a local number, like if you're in Little Rock or whatever. But the 1-800 number, they both ring to the same place. And very important, we want to be able, this is for ages, we've treated so far in the 2 years ages 5 to 94. So our therapists have to be prepared to handle all kinds of different things that might come up. But for kiddos, if you're under 18, your parents have to be on the call, the very first 2 calls. If your parent determines that, hey, and the therapist determined that it's fine for you to do individual therapy with the therapist, just one-on-one, then that's fine. But the first 2 calls, we have to have the parents' consent because we're usually gathering information. And sometimes 13-year-olds aren't the best historians, right? You might leave something. Not that your parents necessarily are either, but we interview both of you. So the thing with AR Connect is that it's free. And it's free because we are grant funded. So, we got a question. Yes, sir.
So is it bad if you don't drink, like, I don't know how much cups of water you're supposed to drink a day?
I think it's changed. It used to be 8 ounces, 64 ounces a day, right? I feel like, I don't know. I don't drink a lot of water. It's not bad if you don't. And now they even count coffee intake as the water in that as well. But don't quote me on that because I drink coffee, so I try to include that with mine. We got one more question back there since I'm talking about free.
Well, this is actually back to your awareness thing. Hi, by the way.
Hello.
But how do we know when someone near us is suffering from any kind of mental illness? Because there's not a lot of awareness around in my community. We don't know the signs. We don't know anything. And there are a lot of kids that go through a lot of things, and they do it all alone.
Yeah. So that's a good point. We could have probably did a whole 45 minutes on those types of things, which you're looking for. I think most importantly, you want to look at changes. Like if someone's used to, say, running track, and all of a sudden they've just lost interest in that, and they drop out, and they quit track, right? Or if they're an A student, and all of a sudden it just doesn't seem like they're caring as much as they are, that's a sign. It doesn't necessarily mean they're depressed, but it's something to look at. Withdrawal from your normal activities or changes to your normal activities is one of the main things to really look for. But like I said, there's a lot. I could get you some information on that. I don't want to leave you hanging like that. Catch me after that. I think if I don't have my contact info on here, I'll get it to you, okay? Yes?
Speaking about awareness, what would you do to raise awareness considering that we use the word being aware when people really don't listen? We live in a world of high society where nobody really wants to be 100% accepting and aware with what everybody else is experiencing.
Well, I think it has to start with you, first and foremost. Just you being aware of your own, and then hopefully that's going to raise enough awareness for you to pay attention to other folks around. What you say about, we don't live in a perfect society, unfortunately. We know that there's all these issues with stigmas and everything else. And, as more people become aware of them, increasing awareness of themselves is just going to increase awareness for everyone. It's a hard question, by the way.
How do you think schools could help with kids' depression?
How do I think they can? They can employ a mental health therapist, for one thing, and a lot do. But there's also kind of a shortage on therapists right now.
Is AR Connect trying to get implemented into schools? Have a physician that could come to schools and meet with students for that first time if a parent was able to meet up there with them?
We're not doing that because we're totally virtual. That's an awesome idea, though, and I'm going to put you in charge of it.
Okay, deal.
No, so the other group that I do run, the school-based mental health clinic, we don't have the physician necessarily come to school, but we'll do a virtual session with the parent and the kiddo to the doctor at the clinic. So they're face-to-face still, but it's over a virtual component, like a video. And that seems to work pretty good. There's a lot of folks with transportation issues, and that helps out. So, all right. So back to this. This is a free program. If someone does have insurance, we'll bill it. If there's a copay associated with it, we will not pass it on to you or your parents. If you don't have insurance, we will help you find insurance. Regardless, it doesn't stop you from getting services. Yeah. Hang on one second. She's going to get you a mic. You guys are talking through those masks. I can't hear you.
It's all right. So when a couple of people mentioned that a lot of stigma originates within the parent. What if the parent isn't okay with therapy or mental health help as a whole? And then when guardian consent is required.
Hold that mic up. I can't.
How does that work?
So
It's some people mentioned that mental health stigma often starts with the parent, and what if the guardian isn't or parent isn't okay with it, and therefore they can't provide consent? They can't provide consent, and when it's required, how does that work?
Yeah, that's a problem, and that's one that pops up. One of the things you can do, we had that happen last week, I believe, in our clinic. So what we did was we asked, this just happened to happen at the school. We asked the guidance counselor to encourage the parent, and the parent ended up consenting. But they didn't think the kid needed help. I'll put it that way. So yes, we have one.
From the virtual audience, what are some techniques for dealing with sudden anxiety?
Oh, wow. So these people are just trying to read my mind or read my slides in the future. So I've got some coping mechanisms for that in the few slides coming through. Okay, so it's always virtual with this program, and so we would, it's always video, and that's good for the most part. It'd be good for the younger crew. Sometimes we have challenges with older population. We see a lot of foreheads sometimes. We have to tell them to bring it down a little bit. Sometimes there's bandwidth issues. Most of the time it works out pretty well. Obviously everything we do is secure and confidential. We have a HIPAA compliant platform. That just means it protects all of your information that's in there. Everything I said, like I mentioned before, we're short-term in nature. 6 sessions on average is actually longer than most people stay in therapy. I know that sounds silly, but if you were to go to a regular outpatient provider and we just went across the platform of all the customers that go there, they would average, I think it's 5.4 visits. So if you would attend all 6 of ours, there's a good chance that that may be all you need. But if you need more, we'll try to find you some more in the community for sure. And then I mentioned this earlier, we have a resource center. Did she put the link on there? I think it's on that flyer back there, but we also have a phone number. If you're looking on the resource center and you can't find some information, you can call it. It's on there. Good. And then there's also an email if you can't find what you're looking for as well. And the email comes to me and our lead care coordinator, so we're the ones answering it. If you have any questions, I'm going to go ahead and give you this information. If you have any questions about today or questions about awareness or whatever that might pop up, you can email me at arconnect@uams.edu. That's the general AR Connect, but I'm the only one that sees that, and I answer them daily. All right. So this is just how we challenge these barriers, right? So cost, lack of insurance, our services are free. PCP referral requirement, it's not referred for us, or required for us, sorry. Stigma. So virtual sessions actually lessen the stigma associated with going in person. One of our success stories, he's from this area actually, but he lived in a little outskirts, and there was a clinic on the outskirts, and he would not go to therapy because of someone seeing his pickup. So he just didn't get any help. And so he was able to get his help through us. He got better, got back on his feet, and that was all because it was virtual. It worked out excellent for him. AR Connect, we don't have long waits. If you call today, most likely you're going to be seen by a therapist. What's today, Wednesday? Probably by Monday. You'll have an intake before then, and then get set up for your first appointment. And then we're always out in different community efforts trying to raise awareness for this program, but also for mental health in general. It's kind of one of our goals. All right, so mental health in the virtual world. I was told I had 15 minutes, so I'm going to get through this stuff. So there are negative impacts, right? Who has a cell phone? That's just a silly question. All right, who is on it more than 3 hours a day? Who's on it more than 5 hours a day? Who's lying? I'm just messing with y'all. So I just recently saw something that said we should take a 3-hour break from social media in general for the day. And not counting your school day, but 3 hours in general. That's what's recommended by a certain doctor. It's not me saying it. I saw it in something else. So basically that means you have, 5-6 hours of free time once you get out of school. So make sure you're trying to stay off your phone or social media for 3 hours. I don't know if that's doable or not. But negative impacts. There's cyberbullying. That can be an issue. Overstimulation. Someone had mentioned something about sleep. One of the common practices is to not be on your phone for 30 minutes before you're going to go to bed. It helps your brain catch up, and that way that increases your ability to sleep. Another thing would be to leave your phone in another room. I know that sounds silly. You might use it as an alarm, but at the same time, if you're trying to go to sleep and all of a sudden you hear a little buzz, you're going to want to get up and see what that was, right? Or you hear something posted or whatever. I'm kind of old. I don't know what all that stuff is. But anyway, the whole idea is you want to try to stay off your phone for 30 minutes before bed, and once you're off, stay off. That's going to help you sleep better. Another thing is you're not as active. Oh, I'm sorry. Yeah.
Being out, so it messes with your actual brain when you're on your phone.
Yes, and then you wake up the next day exhausted, right? Even though you think you're fine. But the other thing it also does is we're not as active as we once were, right? And COVID's one thing, but I used to jog, but then, I found a reason not to, and then I joined a gym, and then COVID hit, and I haven't been back yet. So that's just my fault. But it's the same thing. If we have any reason not to do something active physically, then if it's our phone, then we're going to do that. Well, physical activity helps us sleep as well. So doing something on a regular basis physically is going to help sleep. There's some debate of effectiveness of online learning. I'm not going to debate that. I just know that some people feel like they're not learning as much when they're online. There's also the debate that virtual therapy is not as good as in-person therapy, and I don't think that's the case. Did we have something over here? Oh, I'm sorry.
If they tell you their story about their depression or anxiety, does it make y'all sad?
We're humans, so yes. But we're also trained, and we hear lots and lots of stories. So we just try to help you figure out the best ways for you not to be that way. But that makes us feel good when you figure it out. So yes, we do. It's a struggle. There's such thing. Therapists have a lot of issues. They need to get their own self-care, and a lot of times therapists see other therapists. Yes, ma'am.
People with depression and anxiety find that posting their feelings on social media helps, but other people who are experiencing the same thing come across it, and they're like on their way to getting better, and then they see that, and then it just like puts them down more.
Yeah, I mean, I would, social media, that's a whole nother 45 or, 2-hour discussion. They're your feelings. I mean, if you want to talk to them with your parents or a professional, I think that's one thing, but posting them out on social media sites not the best thing in the world. I mean, it can make you feel better, but you can also write it down on a piece of paper and throw it away or put it in a note. Yes?
Another question from the virtual audience. What are some ways to help your friends get through bad depression?
Give them our phone number. There's one. Be a good friend. Offer to be around them and do some activities and things like that. I mean, those are just, the way I always talk about this is what worked before, right? So if something was working before you had this issue of anxiety or depression, then let it work again. We just have to get through and go back to doing that. Yes.
Hi, so we talked a lot about depression and anxiety, and we touched on chronic mental illnesses like schizophrenia, but what about eating disorders and how that can lead to depression and anxiety and even physical problems within your health?
Yeah, eating disorders are really a tough group. I mean, it's a mental illness as well. There's usually some sort of diagnosis along with eating disorder. There's usually some depression. There could be some trauma. Could be all kinds of different things. But there are a lot of those types of eating disorders lead to physical ailments that can be ultimately can kill someone. So it's a very serious issue. And there's not a lot of specialty therapists that work in eating disorders. So if you have any interest in that, moving forward, that'd be great. We have a handful in Little Rock. But there's a lot of issues with that.
So I actually have a therapist, but I don't feel like it's working just to talk about it. So what other things can you do besides just talking about it?
Well, there's different modes of your therapist. So you can do individual, you can do family. There's also group therapy where you would be in a group with your peers. And, it's really based on the agency if they can do that, but we find that group therapy is really good. We do, in AR Connect, we do a school staff support group, 4 o'clock every Tuesday night, and last night we had 8 folks on there, and it's teachers discussing, the difficult times they're dealing with right now with, and so they all get on there, they all talk, and they talk about similar issues, and it makes them feel better that they're not the only ones dealing with this. So that's one thing. Medication can help as well. It's usually last resort type of thing, though. All right, I'm not going to get through this. You guys are asking too much questions, but that's what we're here for, is for the questions, I think. All right, so here's some positive impacts of technology, obviously. Social connectedness. One thing that I put in this presentation is a couple of mindfulness videos, but unfortunately we can't get the videos to work. But there are all kinds of mindfulness apps out there that are really just fun. Has anybody ever practiced mindfulness in here? Yes, it's awesome. One of the things that we were going to practice was just like a 30-second little video. It was going to walk you through just a quick mindfulness technique, but we don't have time to do that. But they're all over the internet. It's good stuff. But mindfulness is basically just challenging yourself to be here in the moment. That's it. Don't judge. Don't judge your thoughts or things that have happened to you in the past. You're focusing on here. Your eyes are closed. You might focus on that noise, the quiet, the furthest thing away, whatever it may be. But the whole thing you're doing is just practicing the focus right here. And I know it sounds weird, but if you get used to doing that and you take a little bit of time out of your day, it helps you cope better with anxiety and depression. And that's one of the things that we would say is practice mindfulness. Positive impact. So telehealth, obviously, if we couldn't do our virtual mental health, if we couldn't do telehealth video connections. I was on a telehealth work group in 2006, and we had TVs this big, and that's how we had to do telehealth. And you had to do it, and it was just really difficult. Now you can just get on the phone and do it on a big screen, and because technology is so much better. And then obviously, it helps you increase access to health services if you can get virtual, through virtual mental health. And I say virtual mental health, there's all kinds of just virtual health as well. UAMS has a health platform that everything's virtual, doctor's appointments, things like that. Here's some coping mechanisms. One of the things is limiting screen time and social media. It kind of goes with what we were talking about earlier. Is it's perfectly fine to look at your phone and do that type of stuff, but just don't do it all the time. Take a break. I mean, it's a good thing. Take a break, go run around, play basketball, do something, you know. Turn off electronics 30 minutes before bed. Get regular exercise and eat a balanced diet. I think the balanced diet's really important. Make sure you're eating good food, not just junk food. What time? We got 5 minutes. Practice mindfulness activities like we just discussed. And then looking at common stressors in your life. There could be, you know, like, what is it? You go hang out with this certain person, you don't quite feel right. It tends to bring some anxiety or some depression. Or you go and do a certain activity that does that. You can step away from that and say, hey, I don't need to be doing this. You know, it's kind of like if you have a negative peer, or a peer that gets in trouble and you go hang around them, they might have some influence. You might get in trouble. So make a better choice and don't necessarily hang around that person. Yes? Oh, here's the thing that didn't work. Sorry. Here's the other one. Changing perspective. Google that under mindfulness. That's a pretty good one. Yes, ma'am.
I was wondering on what your thoughts are on how the school system can change their impact on mental health. Because I know for like me and stuff, and I feel like this is often for a lot of other students, it's like the school, I feel a pressure that to do everything and be in everything, and just simply being a student and a good student and a teenager just isn't enough, because I'm in literally everything. I'm not going to be at school other than like 2 or 3 days this month because I'm in so many things. Mm-hmm. And that has definitely, you know, had a negative impact, and it's definitely taken me, because I'm in my, you know, almost done with my junior year, and it's taken me this long to realize, hey, maybe I should take a priority of myself other than what they want.
No, I agree. I mean, there's a lot of external pressure for us to get to college, to do good, get certain grades, do all this, be in all these extracurricular activities. Schools can help with making sure that they have someone that will listen. I mean, and I think the schools in Arkansas over the last 20 years have shown a great improvement in that, but they still have a ways to go. That's not just here, it's everywhere. But yeah, that would be a great thing, is to have somebody available to listen.
Speaking of school systems, we have a project on suicide prevention at our booth, and we thought that teachers could go through training to notice the signs of students who are experiencing suicidal thoughts. And we also thought that schools could send out surveys at least every month to check up on the students and to reassure the teachers that their students are in a good mental state.
I totally agree, and I know there are a couple of different initiatives going on in the state right now. One is mental health first aid. It's done by the Department of Ed. They are going around training teachers. There's also a group called TRIS, which is the Trauma Recovery something for schools, but it's through Our Best, and they're going around educating teachers and administrators on how to recognize trauma-informed practices, recognize if there's been trauma that kids are dealing with. And those kids that have identified as having dealt with some trauma get referred to us so that we can help. So, all right.
There have been a few students that also had questions, and I'm sorry we can't get to everybody in the audience. If you would like to finish up, and if anyone has questions, perhaps they could come to you after.
Yes, and if you copy down that email address too, you can email me. I'll answer your questions too. Unfortunately, when having everyone ask questions, we don't get through everything, but that's okay, because you guys asking questions is, I think, more important to why I'm up here, rather than going through something that's on a slideshow. So, anyway, technology used to provide mental health care. Obviously, there's all kinds of technology involved when we're doing a video session. There are mobile applications. There's a mindfulness and positive affirmation application that's good. You can just pull it up on your phone. There's an application called UAMS Now. There's tons of applications out there that are good. You can even get a mental health coach via application. I can't remember, there's another one too. But that's how technology is used. There's obviously considerations for the future. Right now there's limitations. Sometimes your insurance companies don't want to pay for virtual sessions. Or they limit the amount of virtual sessions. Or they say, care only starts when you are face-to-face with the physician, then after that you can do virtual sessions. That's something that we have to do. Everybody in this group has to do, is lobby to get the insurance companies to pay for these virtual visits. And let's see, mindfulness. Oh, there's resource locator apps. If you guys need some assistance on that resource page that I was talking about, you can put in your zip code and it'll show you all kinds of providers in your area. And you can always ask questions if so. My time is officially, I got the big 0. So my time is up. So thank you so much. Oh, look at that, we're done.